Oh, hip pain, Mike. All right, if you're experiencing severe hip pain, you know, whether it's from bursitis, arthritis, or simply from a fall, we are going to show you 5 proven techniques to get that hip pain out of the way and get you on with your life.
Is one of the techniques wearing red pants?
Mike, these pants are proven. Let's get on with this.
So looking at the hip joint itself, it is a ball and socket joint, and it is very stable and quite mobile. Now, common problems might be arthritis, which typically happens in the joint itself right here. Another common problem is bursitis, which is typically on the lateral or outside of the hip, and Brad's going to talk about some of the other problems.
So on there's a capsule, which is shown here. We got ligaments, and that holds in the synovial fluid. That can become pinched. It can become tore, like the labrum, which you cannot see, which is our cartilage that helps support the joint. That can actually tear a little bit. All of them can cause problems and pain and severe pain. We're going to show you 5 options, and typically you'll find 1 or 2 of them that will give you relief.
Now, if you're having some bursitis or outside hip pain and it's really bothering you, a good thing is to get off your feet and to get into a side-lying position. Now, you don't want to lay on your painful side. That's going to cause more irritation. So, you want to put the good side up. Now, if I'm side-lying and I'm like this is putting a lot of stretch, especially over the lateral hip here. It's going to be more problematic. This is a little bit better, but you can still see it's going down, putting tension here. So what you actually want to do is grab another pillow. Different thicknesses will help, and you want to put it the long way like this, and it's going to be more even. This will take the stress off of that lateral hip, and Brad has another tip you can use.
Right, so in this position, and this could be from a fall too, if you've got a bruised hip, or like he said, bursitis, lying like this, getting a comfortable position, and then taking a cold pack, one like this that actually is moldable to your skin so it conforms good surface area contact to that hip. Put that right there, 15 to 20 minutes, you're comfortable. That can bring your pain from a 10 all the way down to the below 5 easily, so you can get up and start to move around again. All right, so tip number 2. Now this one I have had work very well with patients with either a labrum tear or arthritis, or it could be one of the other 3 as well. But we're gonna find a step so you can come up on. It's nice to have a handrail for balance. Now the right hip is actually the painful hip, and it typically hurts with weight bearing. So if that's what's going on every time you put weight through that hip and it increases pain, there's a good chance this is going to offer good relief. So you're going to put your good leg up on the step. The painful side is going to be dangling, just like a pendulum. Everything is going to be relaxed throughout the leg, and then we're going to hold here for balance so we can maintain a relaxed hip, and then simply swing it gently forward and backwards. Now what's going on, we're getting traction or decompression through the hip, allowing that ball to separate from the socket slightly. If it's arthritis, offers relief there. If it's a torn labrum, it takes the pressure off that labrum, and we get some movement in there, improve circulation. Now you can work it this way, you can turn sideways. Sometimes it helps to go right to left. You do whichever feels better. If they both feel good, you can do them both. You'll probably be here for about a minute or 2, and then see how it responds after you get going. A lot of times that works very, very well. We're going to show you another technique which actually piggybacks with this in just a little bit.
Now this next stretch can help if you notice that you have an anterior pelvic tilt. Now what that means is when you stand up straight, your pelvis is kind of tilted forward like this, which can happen as we age, especially if you sit a lot. So we want to try to get you in an upright position. This can relieve some tension in your hips that could be causing your pain. To perform this, you'll need a firm surface. You can do this on a table, countertop if you can lay down, or firm bed. You're going to start laying down on your back. Bring both knees to your chest to start. Make sure your back is nice and flat. Then I'm going to stretch my left leg first.
Mike, before we go no farther, make sure you're attentive to how far your hips or your butt is to the edge of the platform that you're on. The closer you get to the edge, the more aggressive the stretch will be.
Yes, if I'm back here, it'll be easier. Down here, a little more aggressive. So I'm going to lower my left leg down first. I'm going to keep it in a nice straight line. Once I'm here, I'm going to try to bend my knee what I comfortably can, laying back like this. Bring both hands on the opposite leg. pull up, you'll see how much tightness I have when I start pulling up like this. Just try to keep this leg down what you can. Hold this for 30 seconds. After 30 seconds, you're going to reset both knees to chest like this. This should feel good. And then perform on the other side. Again, bending the knee. You might notice one side is tighter than the other. Maybe do an extra set of stretching on that side. Recommend 2 to 3 sets of 30-second holds for this.
Now, if you're doing this one and it actually irritates the sore hip, stop right away. You're not going to push through it. It should feel like a good stretch, like as you stretch longer, the pain is releasing right away. So have good judgment with it and take your time. Number 4, we're going to talk about if you have pain with weight bearing and you put weight through it and it hurts. It's very distinct. Weight bearing increases pain. Now, this is the one I referred to before, piggybacking with the exercise where you do the pendulum and swing while standing on a step. These two can work together very well. What you're going to need to do is something you do not want to do, or most people don't want to do, and that's simply use a cane. People just don't feel comfortable sitting with a cane. You just have to get over it. So what you'll do is take a cane. Hopefully you have one you can test with. Make sure it's the right height when you're standing tall. Let this arm down. The crease of the wrist should line up with the handle, plus or minus a little bit. It's not very exact, but pretty close to that. My right hip is sore. The cane is going to be in the opposite hand. Okay, it works better with that way. Just trust me. So when the right leg goes forward, the cane goes with it. I'm putting weight through this side, unloading the hip, and stepping through. So the cane and the sore leg work together in unison. They can make a big difference. I've had people say, I'm not using a cane. I say, just give it a try. Here we are in the clinic to see how it goes. And they'll use it. And it's like, oh, pain goes from a 10 down to a 3. They decide the cane's a pretty good idea. The whole idea is you're not going to be stuck with the cane forever. Let the hip unload, get it time to rest down. In a few days, you can get rid of the cane. I personally had a labrum problem. I actually had to use crutches. It was so painful. I actually considered going in to see the doctor and get x-rays. But the crutches for 2 to 3 days started to feel much better. The crutches were gone, and it went back to normal all by itself. So that's a nice key, and that's the goal.
Us therapists are stubborn.
Well, you know, we were born that way, and they taught us it in school.
Now, the last stretch we're going to do, you're going to be laying down in bed. Now, you're going to pick which one feels best for you. We're just going to go through a bunch of different hip motions. If one area is painful, avoid that. Do which ones feel good for your hip issues. To begin, I'm going to stretch my left leg. We're saying this is my good leg first, then go to the bad leg to see the discrepancies. So first, you're just going to start with the knee to chest like this. You can become straight up, or you can go slightly out to the side. My anatomical build, I can actually go higher out to the side. Just do what feels good for you. After this, try bringing across your body. See if you feel a good stretch here. Notice the rest of my body is still facing up. I'm not falling over. You can hold this. If this feels good, it's a good outer hip stretch. You can also try bending your opposite leg, and this is called a figure 4. So what I'm doing is ankle is touching this knee, and then you try to bring this down here. Stretch like this. This is a good option. This may be all you need to do. If you want to get a little more fancy with this one, you could certainly grab the opposite leg and pull up. If this is uncomfortable, do not worry about that. But just go which motion in the hip feels the best and stretch that out. Then go to the...
Wait, Mike, I want to add one more.
One more?
Yep, go back down. For those of you who cannot do that figure 4 he mentioned, you can actually do it with this leg down, and that's a little bit less aggressive. Particularly older people, I think, may respond better to this. I don't know. What do you think?
Yes, this is a good beginner version of the figure 4
Sure.
stretch. Now what you're going to do is go to the side that is more limited or painful and see if you notice any differences, and then you can kind of figure out what you need to work on. Maybe you can't figure 4 this high on this side, but you can down here. Start there then. Maybe you can't bring it across as well. Just do what you can within this hip to get it moving a little better. Sometimes just getting that joint moving will help.
Good job, Mike. Now, another option, if you happen to have a massage gun, I had a hip patient, he used a massage gun, and it really had success with it reducing that muscle tightness around the hip. He had severe arthritis. The muscles tightened up inherently as a result of the arthritic pain, but the massage guns worked very well. He was grateful. This is a smaller one. You know, these are ours. We know they're good products. That's why we have our name on them. This is the Q2 or the C2. If you are a larger person with a lot of muscle, you can probably go with the bigger one, or the smaller one is actually easier to hold on to. They both will work well. I would suggest using the round head like that's on this one, or the airhead. They're not real aggressive, but they're going to get the job done. You know, they simply pull in and out without any tools needed. Other options are here. These are all more aggressive. You can use those if you want. Start out with these for sure. Now, here I'll demonstrate a system that I like to use. We got the hip joint right there. You can feel the bone. That's your greater trochanter. Do not go on that. That is going to irritate you, particularly if you have bursitis. That will make it worse. We don't massage on a bone. We go into the muscle. I'm going to flex my hips slightly. You know, if I want, you can put a pillow under here so it's more comfortable. And then simply start working on that glute max. That's the big muscle on your buttocks. And work on that. Now, you get over that piriformis muscle, which is very commonly tight right in here, and you'll feel it. It might be a little painful when you get to the spot that knots up. You're going to work around that painful spot, and within 30 seconds or so, typically will loosen up, feel better, and then simply work your way up. Again, not on that bone, but above it is the glute medius. You can straighten the leg out if you want, bend it, work in here, and then we're going to progress to the anterior or the hip flexors here. Works good if you lie down, leg here, this leg up, and work on that. Now here you have to be very careful because you have lymph nodes right in there. You do not want to massage on the lymph nodes. We're going to keep it off to the side. You can work it down onto the quadriceps and work that. You typically work the massage gun 2 or 3 minutes. That will typically be enough. When you're done, should feel good. Everything with a massage gun should feel good. If it hurts, and it hurts more than 15 seconds or so, back off. It's not ready for it. But if you have one or you're interested, they are a good option for getting muscles loose, getting the circulation improved, and releasing that pain. My hip feels better already, and it didn't even hurt. Seriously, they work well. All right, Mike, come back in here.
Now, if you want to check out more videos about common causes of hip pain, you can click the video here, but sometime in the future, in the next week or two, we will be releasing a video on strengthening the hip as well, which is very important. Once you get that pain to go away, get it nice and strong, and that'll help as well.
That's right. That one's already in the books. We just got to produce it.
Bob and Brad, the two most famous physical therapists on